Greetings. I'm Dr. Jamie Barney, and I'm the Vice President of Behavioral Health here at Open Healthcare Clinic. This year, we are celebrating 10 years as a federally qualified health center, and so we want to take you on a tour to show you where it all began. So we're going to bring you to 1995. During this time frame, our president was Bill Clinton. Our governor was Edwin Edwards, who had just beat out David Duke for that spot. And the mayor president in Baton Rouge area was Thomas McHugh. During this time frame, we also had a multitude of persons who came out sharing their diagnosis of HIV or who passed due to complications related to HIV, such as Greg Louganis, Eazy-E, Ryan White, and Hadia Broadbent. So after 6 years in 2001, HART received HUD funding to provide housing services, which launched the first service line at HART. And we were providing housing services for persons living with HIV, funded by HOPWA. Then, as we continue to expand services, we provided Ryan White case management, and one of our staple events was Light Up the Levee, held in Baton Rouge. This was held to coincide with the International AIDS Candlelight Memorial. By August 1990, more than 100,000 persons in the U.S. had died from an AIDS-related illness. That includes Ryan White. So President George Bush signed the Ryan White Care Act into law. The Louisiana Department of Health was the entity in Louisiana that administered Ryan White funds. They had regional offices develop a consortium of providers and key stakeholders to administer those funds. In Baton Rouge, that group established themselves as HIV/AIDS Alliance for Region 2 in 1995. It also became evident as we provided social services to the community members that there was not a sufficient amount of medical providers providing services to people living with HIV, especially to community members who were underinsured, uninsured, or had low income. So in response to that need, our organization launched the Caring Clinic of Louisiana. So it is Monday, July 9th, 2007. And Dr. James Osterberger established our medical services here at Caring Clinic of Louisiana. This room is a replication of our very first waiting room. It's actually a little larger than our first waiting room. And this is some information from Dr. Osterberger's work to end the HIV epidemic and fight against the HIV epidemic. He's actually one of the first medical providers to incorporate treatment to persons living with HIV into his practice, so we were very lucky to be able to have him launch our medical services to that community. When our organization started providing medical services to persons living with HIV, the treatment regimen was very stressful for persons. We had paper charts and large file cabinets. This represents 2 months of medication. So medication would come in bottles this size. The smaller bottles represent 1,200 pills. So if a patient were following their provider's medical advice, these bottles would be empty within a 2-month period. The pills on the table represent 1 day of medication. They had very strict time frames within which they had to be taken. They had to be refrigerated. They had to be taken with 8 to 16 ounces of water at each dose, and this was persons taking medication every 3 or 4 hours. This lists some of the side effects of the medication that were very probable for persons living with HIV. This is pre-1990s, and unfortunately, the medication, while it did help, it had limited time frame within which it extended the life of persons living with HIV during this time frame. So initially, the medications would extend a person's life for 1 to 2 years. Over time, the length of time the medications added to a life in on average expanded. So it went from 1 to 2 years to 5 to 10 years. In 1995, 1996, the heart regimen became available, and so this medication regimen extended the lives of persons living with HIV even more. So, as our services expanded to meet the needs of this very vulnerable population, we also engaged in a lot of community activities to inspire hope and reduce stigma regarding HIV, encouraging persons to get tested and to get into treatment to take care of themselves. So after 20 years of service and cooperation, our organization decided to expand services to focus on providing care to the whole community. In 2015, we became Open Healthcare Clinic, a federally qualified health center providing whole care for the whole community. So now the medical services provided at Open Healthcare Clinic have expanded along with the advancements in medicine and technology. We use an electronic medical record, and we are providing patients with prescriptions for injections instead of daily medications. So this is an example of Cabenuva. Our patients are able to start treatment on day one and get an injection with Cabenuva, and then 2 months later come in for another injection. So instead of 1,200 pills within a 2-month period, our patients have 2 injections. We are currently at our Airline Highway location where we are undergoing construction. These are our anticipated plans for this building, and we currently are undergoing renovation in our behavioral health wing. We are anticipating that will be done in the winter of this year, and that is going to allow us to expand much needed mental health services to this community. Because we are committed to providing whole care for the whole community, we are expanding services, and we are very excited for what Open Healthcare Clinic will be doing in the Baton Rouge community. Persons who were able to attend the museum were able to identify areas where we can expand our school-based services by putting a pin on our map of Louisiana. We also had our attendees identify potential areas for growth by pinpointing areas on the southeastern United States map where we can potentially add additional clinics.